You look at your 10-year-old dog panting quietly on your living room floor. You probably tell yourself a very common lie. Oh, they are just getting old and tired. I am here to shatter that dangerous illusion. As a groomer for over 20 years, I have seen how this false comfort kills. Heavy breathing at rest is never just age. It is a siren going off inside their body. Let's dissect exactly what is happening. Recently, a senior dog visited this very room. At first glance, it was a routine session, but within minutes, severe distress began. The dog wasn't just panting from anxiety. Their stomach muscles were contracting hard. I immediately stopped all grooming procedures. The neurological panic was deeply evident. Their brain was screaming for oxygen. I sent them to the emergency vet instantly. That decision uncovered a hidden nightmare. Dogs pant to regulate body temperature naturally. But let's look at the behavioral psychology. Normal panting happens with a relaxed mouth. Pathological distress looks entirely different. The facial muscles lock into a grimace. Respiration exceeds 30 breaths a minute. This happens while completely at rest. The brain detects a severe drop in oxygen. This triggers a massive stress response. Your dog is quietly fighting for survival. We must understand the medical reality here. Primary lung tumors start in the lung tissue. They are rare but exceptionally aggressive. 70% will metastasize very rapidly. They spread to lymph nodes and other lobes. The delicate cellular structure is destroyed. Oxygen exchange becomes physically impossible. This is not a behavioral quirk or aging. It is a structural collapse of the airway. Time is the only currency you have left. Metastatic lung cancer is far more common. Cancer cells migrate from other body parts. They settle into the lungs like invaders. During grooming, I constantly check for lumps. A hidden mass can compromise everything. This triggers secondary heart complications. Fluid accumulates, causing a moist cough. A dry hack means tracheal irritation. Every sound your dog makes is data. You must learn to read this vital data. You might be watching their breathing closely. But here's the most critical mistake. You are ignoring the companion symptoms entirely. Heavy breathing rarely happens in isolation. You might see unexplained lameness suddenly, or perhaps unusual hair loss and skin ulcers. These are not random signs of getting older. They are complex biochemical distress signals. The tumor secretes hormones into the blood. This affects entirely unrelated body systems. Let's talk about the ultimate red flag: coughing up tiny flecks of blood. Tumors aggressively erode delicate blood vessels. Internal tissue damage is actively occurring. Combine this with profound resting lethargy. Their muscles fail because oxygen is gone. Even walking across the room is impossible. Do not wait to see if they feel better. This is an absolute medical emergency. Your dog's internal systems are crashing. Standard chest X-rays are just the beginning. They show structural changes and fluid buildup, but they miss tiny metastatic nodules often. This is why CT scans are non-negotiable. They provide a three-dimensional battle map. Next comes fine needle aspiration, or FNA. Extracting cellular samples reveals the truth. We must know the exact microscopic enemy. Guessing leads to ineffective, fatal delays. Demand comprehensive imaging from your vet. If the tumor is isolated, surgery is possible. Removing the lobe physically restores airflow. But if metastasis is widespread, we pivot. Chemotherapy and radiation become the tools. However, we must weigh comfort against cure. Palliative care is sometimes the bravest choice. We suppress the cough and reduce inflammation. We prioritize their dignity and daily peace. Every single remaining day becomes a gift. We manage their pain with absolute precision. Stop blaming every change on just old age. Eliminate smoke and toxins from your home. Establish a strict 6-month vet schedule. Here at the salon, I use hypoallergenic care. Stress-free handling keeps their airways calm. Your daily observation is their best defense. Do not let false comfort cost their life. Be the clinical advocate they desperately need. For more expert grooming protocols, visit Poocheshairstudio.com and Poochestips.com.